Okay, Unit 3. I'm going to go through, follow what's in the course, so sort of roughly in that kind of order. So what we're going to look at now, we've looked at the macronutrients, we looked at the micronutrients this morning, and now we're going to put it together and look at the different diets. So there's no such thing as a one diet fits all, but we'll look at different ideas of diets. We'll look at different constitutions and the needs of different constitutions, and then look at blood sugar regulation. And detoxification and bowels. Okay. So, as I said, there's no one diet that fits all. There's so many different diets, and people are getting extremely confused with what they should or shouldn't eat. Personally, I think it's determined by what you've inherited, whether you've inherited a blood sugar issue, whether you've inherited certain deficiencies, what your blood group is, what your constitution is, and your levels of stress. That will all determine what kind of diet is right for you at this point in time. This is the Eat Well plate, which is government based. So we've got we can see it's mainly carbohydrates there. So we've got loads of vegetables, which is good, but we've also got quite a lot of carbohydrates, a little bit of protein, so not too much acidity. This is going to be very acidic though. So if we're looking at it from an acid-alkaline angle, then we've got a lot of acidity there. We haven't quite enough vegetables to balance that. Plus, we've got an awful lot of carbohydrates. So if somebody has got a bit of a blood sugar issue, then that would be pushing their blood sugar up and then back down again quickly, and then back up again and back down again. Now, in the course, in Ballantyne, who he trained as a doctor and then he went to India and studied Ayurvedic medicine, he's saying, you know, that the best diet is based with the bread, the grains or the starches, then the vegetables, and then the pulses and fermented foods, and then some raw food, and then we can put the oils and the water on top of that. Now that's fine if you're living with no stress, but if you've got that amount of carbohydrate in the diet, which vegetarians often do, then you could be disturbing your blood sugar regulation quite a bit. So we're finding now that more and more people need protein. So a lot of nutritional therapists are encouraging people to eat a bit more protein, which yes, it is acidic, but you have to balance it with the vegetables to get that balance, acid-alkaline balance there. And a lot of people are thinking that, you know, yes, they'll eat more protein, but they forget to do the vegetable bit. And the reason people need more protein is the amount of stress that they're under, because stress causes fluctuations in blood sugar. So also in the course, the questions are asked, well, how much should we eat, when should we eat, how often should we eat? So how much will depend on all sorts of factors, really. In the course it's mentioned that 3 meals should be eaten a day, which is really good advice. 3 meals, and then you have at least 4 to 5 hour gap between that. So research has shown that that will be quite a stabilising diet, with no snacking in between. We've got just the 3 meals, which is how people used to eat back sort of 60s, 50s. It's only recently that people started snacking. You see people walking down the street and they're continually eating things that wouldn't have seen that in the 60s. Now, the book that I've put there, Mindless Eating, is looking at the connection between emotions and eating. So if any of you are interested in sort of looking at that in a little bit more detail, then that's a really good book. Fascinating studies that he's done in there. And one of the examples he gives in there is the way that we are affected by food on an emotional level. So as an example, if we think of maybe a Chinese student coming to Britain to learn in a university, and she goes off to university and she's trying to make friends with everybody, and maybe the group of girls that she's with say, hey, let's go for a coffee and some biscuits. They have chocolate chip cookies, and she's never had chocolate chip cookies before, so that's not part of her diet normally. But she's having a good time and she's making friends. And then the next time she has it, it's the same situation. She's relaxing, she's having a good time with her friends, and there's the chocolate chip cookies there. So then the mind associates chocolate chip cookies with good time. And then she has to have the chocolate chip cookies eventually to have a good time. So we get the messages muddled up. So when we're sort of saying how much, it depends on how much the emotions are actually affecting our food choices. And we should stop when we're nearly full. But most of us don't. We haven't got that message there that says, oh, actually, you're nearly full. And if we've been bottle fed, where we've had the milk just thrown down the throat, then we won't know when to stop. Whereas a breastfed baby will suckle, and it can also continue to suckle, but actually not bring any milk out. So it can control what it wants. But if you're bottle fed, it's just thrown down your throat. And so often people that are bottle fed haven't got that way of being able to say, oh, I've had enough now. And when is the best time for breakfast, for example? So in the course, it talks about having the biggest meal at breakfast, because this is the meal that's going to set us up for the day, and having a carbohydrate breakfast because we need to produce the energy, which all makes loads of sense. But what I'm finding with a lot of my clients, predominantly most of them, is that if they have a carbohydrate breakfast, they're all over the place for the rest of the day because the blood sugar goes up and then it's crashing down about an hour later, and they're hungry, they can't think straight. So then they'll have their cup of tea or their cup of coffee and push the blood sugar back up again. So I'm having to start people on a protein breakfast, and that seems to work really well, and then they're okay and they can have their carbohydrates later. So it will depend on what is going on with each individual as to whether they should have carbohydrate or protein for breakfast. It's not straightforward. And then the other thing is, when should we have the biggest meal of the day? So we used to say, breakfast like a king, lunch like a pauper, etc. So the biggest meal should be at breakfast. And that's what Chinese medicine says. So if we look at the Chinese clock and the different the times of the day when the organs are most active. So we've got this is 7 o'clock in the morning here to 9 o'clock in the morning. So we've got the stomach most active. And so basically what the Chinese do is they have their biggest meal at breakfast. And then we've got the spleen, and then we've got the heart, and we go on round. So if you know when you're doing a case history, and you can find out when they're feeling really tired, or maybe when they're waking up in the middle of the night. So for example, you might find a lot of people wake between 1 and 3 in the morning. So this is liver here. That's when the liver's most active. And that's when the liver detoxifies 2 o'clock in the morning. That Western science has proved that. So the Chinese were right there. And you can start to see where these connections are when you're taking a case history, that if they're waking at that time, then they may have a bit of a liver imbalance or it might need some support. Lungs is between 3 and 5, then asthma attacks are there. That's when the blood sugar's at its lowest. And asthma is a blood sugar issue as well. So it can tell you quite a bit. But yeah, so that's a little bit clearer there. So we've got, in the morning there, 7 to 9 is stomach there. Large intestines before, so should be bowel movement, eat, and then you go through the day. That's what the Chinese say.
You're working through the night?
Yeah, bad news.
Yeah.
Yeah, higher risk of cancer and all sorts of things because melatonin.
Every individual body is working to this same clock.
Yeah, if it's in balance, it will be. Yeah,
so our bladders are about to take over from our small intestine.
Where are we now? We're
so 1 to
2.
Small intestine. Yeah.
1 to 3,
Moving
small
into our
intestine.
bladder area.
Yeah. Okay, this is from an Ayurvedic perspective, which is slightly different. So in Ayurveda, they say the biggest meal should be taken at lunchtime, which they call Pitta time. Pitta is the fire in the body, it's the digestion, it's the digestive processes, the endocrine system. So between 10 and 2 is when the Pitta energy rises in the body and the stomach acid rises in the body. And they've actually proven that now, that the stomach acid is highest at midday. So that would suggest that that would be the time to have, the protein meals, because that's when protein would be digested best. Okay, so we're going to have a look at just different diets now. So pregnancy, so there's lots of changes in pregnancy. Obviously the woman needs lots more nutrients. The baby needs plenty of zinc for growth. So it's best, if they can take a multivitamin and mineral, pregnancy multivitamin and mineral is the safest thing to give them, because then you know that it's been checked and it's got everything in balance, rather than saying, oh, you should take this, you should take that, just a pregnancy multivitamin. And it's important for them to stay off any food allergies or anything they're sensitive to, because they'll pass that on to the baby. The egg takes 4 months to form, so it's important, well, I feel it's important for a preconception program, so that people that want children actually start to make sure that they've got the nutrients available, because whatever nutrients they've got, that gets passed on to the baby, and children are being born more and more deficient. And there was some research done, I think in the 1950s or 1940s, by Dr. Pottinger and his cats, and he took a litter of kittens, divided them into 2, and he had one side of the litter was fed raw meat and raw milk, and the other side of the litter was fed cooked meat and pasteurised milk. That was the only difference. And then he monitored them over 4 generations, and he found that by the 3rd generation they couldn't reproduce, or they were being born stillborn. So that just really shows how important diet is, but very important for women to get sorted out before they have their children. The other thing that happens is, obviously there's the changes in the hormones there, but with the changes in the hormones, with estrogen and progesterone rising, the blood sugars also rises. And sometimes people can feel really well when they're pregnant. It's possibly because they've got low blood sugar, and then when they get pregnant, the blood sugar rises, and so then they feel more normal, they feel better. So anybody that says, oh yeah, I felt really, really well when I was pregnant, it was the best I ever felt, then you think, well, why did you feel better when you were pregnant? So then you look at the changes, the insulin levels have decreased, blood sugar's gone up, so that might be one of the factors. Or it could be that the thyroid's a little bit low and the baby's compensating as well by producing more thyroid hormone. So the avoidances in pregnancy then, alcohol. So this is taken from Foresight. So Foresight is a charity set up by a formidable lady back in the 1980s who was just passionate about girls getting themselves sorted out before they got pregnant. And so she did lots of research, set up the Foresight charity, and then paid for researchers to look into everything that affected the health, what was needed during pregnancy and what wasn't needed. So from their research, any level of alcohol during pregnancy reduces fertility by 50%. And so beforehand as well, if you're drinking alcohol beforehand. Those women drinking up to 5 units a week are 2 times more likely to conceive than those who drink more. So if you're drinking more than 5 units, then you have less chance. So basically the more alcohol you drink, the less chance of conceiving. At 2 alcoholic drinks per week, the miscarriage rate was 25%. And 4 drinks daily resulted in a 19% chance of abnormalities. And 2 to 4 drinks daily resulted in an 11% chance of abnormalities. So the more you drink, basically, the more problems you're going to have. Fewer than 2 drinks daily resulted in 2% increase. So you've still got the risk there. Caffeine is another one that can be a problem in pregnancy because it adversely affects the way that the sperm move forward. It contributes to colic, restlessness and irritableness when the babies are being breastfed. Pregnant women metabolize caffeine 3 times slower than non-pregnant women, so it affects the liver function. So a lot of people when they're pregnant find that they can't drink coffee. So if they're not metabolizing it, then there's this build-up of coffee in the system. Decaf coffee is also linked to miscarriages. And 1 cup of coffee daily can cut the chance of conceiving by half. And fizzy drinks can be higher than coffee in caffeine. And that's just a diagram there of fetal alcohol syndrome. So when women do drink alcohol when they're pregnant, very often the babies will be underweight. So we're looking at less than 7 pounds, quite sometimes a lot less than 7 pounds. And also they can have the changes in the face as well. So pregnancy diet is pretty straightforward and common sense really, not to take any of the pesticides in because that can go across the placenta. So lots of organic whole foods, fruit, vegetables, sprouted pulses and seeds because they're easier to digest. The organic produce there, and then taking in essential fatty acids from the fish, nuts and seeds, there is an increased need for protein, so they do need to increase their protein because obviously they're growing a baby. And preconceptional programs tend to consist of screening for the sexually transmitted diseases such as chlamydia, and a vitamin and mineral program which is based on a hair analysis. So some of the hair is taken and that will show what the levels of vitamins and minerals are, and particularly zinc, getting the zinc levels up, and looking for any heavy metals like lead. Obviously avoidance of chemicals, avoidance of any food allergies, and it goes without saying the cigarettes and the alcohol. And then morning sickness I've sort of touched on a little bit, deficiency in B6 and zinc. It's also the blood sugar is a little bit too low, so they're feeling sort of more nauseous. So everything is more accentuated when a woman is pregnant. So although blood sugar generally rises, then at the first 3 months with the sickness, the blood sugar is lower. They're not going to be able to bring it up as quickly. And somebody did some research about 50 years ago with low adrenals and pregnancy, and they actually gave pregnant women adrenal extract from an animal, which we call a glandular, and that actually brought the blood sugar up enough, supported the adrenals, and those people didn't get the morning sickness. So morning sickness is also associated with the adrenals being a little bit low.